Here's a trauma doctor discusses her own approach to her breast cancer diagnosis, and she refused to take chemo and radiation. Dr. Lorraine Day briefly explains.
And now I've got a great big depression right here. In fact, you can feel where all of the soft tissue was pushed away by the tumor.
Right.
And I've got a big depression. I've got nothing there. There's nothing there.
Right.
Besides that, how do you know when you're over the flu? Because you don't feel sick anymore. Right? People say, well, how do you know you're well? I was so terribly sick. I was so terribly sick that now I'm not.
Right.
And so, but most people, when they have a tumor that size, they go and have it removed. So then how do you follow your progress?
Mm-hmm.
You see, you don't know if what you're doing is working if you've had the tumor removed. You need the tumor there to show you, is it receding? But doctors tell patients, you can't do it that way. We have to cut it out. But the reason that people have recurrences is that they first of all have chemotherapy and radiation, which destroys your immune system. You need your immune system to get you well. And when you have it destroyed with the chemo and radiation, yes, it will destroy the tumor for a time, but it also destroys your immune system. And so then the tumor will always come back. It will always come back. If you have enough immune system left to fight it, you may survive for some period of time or maybe for a long time. But if most people, or many people, their immune systems are so destroyed by the treatment that when the tumor comes back, they have nothing left to fight it with, or they give them more chemo and more radiation, and then that kills them. I've watched that happen to so many people, including friends of mine who were too afraid to do what I did because they wanted to believe the white coats. You see,
And you are a white coat.
I am a white coat. And I know that white coats don't know how to do this. They say they do, but that's because we're taught that. Doctors fear cancer more than non-doctors because the layperson believes that they can go to their doctor and their doctor can fix it. The doctor knows they can't fix it. And doctors talk among themselves about, are we going to kill the patient first or are we going to kill the tumor? But you see, you can't just really kill a tumor. The body, as I said earlier, is meant to heal itself. What we have to do is stop injuring it. And we injure it by the way we eat, the way we live. This is all kind of trauma. If you took a hammer and hit your thumb every day, you'd make it into hamburger, and it wouldn't get well if you kept hitting it every day. You've got to stop doing the things that cause the injury to the body. And the problem is that most people don't know. And certainly the doctors don't know. We're never taught that. I mean, doctors have a shorter life expectancy than the general population, and they have a higher suicide rate. So why would you want to go to them for your health?
Well,
Amen.
and that brings up a whole different line of questioning, but I want to get back for just a moment too to the barley greens.
Oh, yes.
And also the